Hi everyone. So welcome to this series. So in this series I'll be talking about some of the very major important topics that you should not skip. Okay. So let's start. So a young lady was advised a fat-free diet but replaced them with the carbohydrates. Continues to grow overweight. So which of the following is not involved in fatty acid synthesis? So the question is on the weight gain or overweight, right? But she is consuming carbs. So carbs can also increase the weight, right? So first of all, the question is not involved in fatty acid synthesis. So guys, in the fatty acid synthesis, we need the rate limiting enzyme. This is called as the acetyl coenzyme carboxylase. Then acetyl coenzyme carboxylase is acted upon by biotin. So biotin is a cofactor. So this is the vitamin. And guys, citrate is also required here. Citrate is the allosteric activator, right? Then we have alanine. No. So that is our answer. And ATP. Yes. Fine. So these are the important points which are involved in the fatty acid synthesis, right? Fatty acid synthesis occurs in liver cytoplasm. So that we all know. Fine. Now guys, in this question, there is increase in the weight. Now the weight is increased because of the one reason, and that is, guys, the carbohydrates. When she consumes excess amount of the carbs, right? Carbs makes the pyruvate, pyruvate makes the acetyl-CoA, and acetyl-CoA makes the fatty acid, and fatty acid makes the TG, and TG makes the VLDL in the liver. So this question has been also asked in such a way like, what is the lipoprotein produced when a person consumes a high carbohydrate diet? So the answer is VLDL. Okay, so VLDL is produced, correct? So I mean, like, fat is produced. So moving to the next question. So guys, what I mean to say is lipoproteins and fatty acid synthesis is a very important topic, especially the lipoproteins. So in this next question, in this era of natural supplements, medication, toxicity remains a major cause of concern. Biotransformation of drugs are a major function of liver. Drug-induced liver injury can be serious enough to cause fulminant hepatic failure, resulting in the death or liver transplantation. Which of the following vitamin toxicity can present with the above presentation? So guys, vitamin are very important topics. Vitamin deficiency, we all remember most of the time, but toxicity, only few vitamins are toxic. Which is the very toxic vitamins like niacin, then we have B6, vitamin D, vitamin A. So these are very few names which are toxic vitamins. So guys, in this case, there is hepatic failure, and the answer is niacin. So guys, niacin presents with the various complications, and the names of these complications are like increase in the glucose concentration, then guys, U for uric acid is increased, liver failure, and flushing. Okay, and we can remember this mnemonic as Gulf, and we can remember Gulf of Mexico, Mexico for the macular cyst, right? In this case, it will be macular cyst. Fine guys, so niacin. Now talking about other toxicities. See, in the water soluble vitamins, very few are toxic. B6 is also toxic, and that causes neuropathies, right? And niacin causes all these toxicities. I told you, high glucose, uric acid, fine, hyperuricemia, and then the liver failure and the flushing, right? Mexico for the macular cyst, right guys, macular cyst. Now vitamin K is also toxic, that causes hemolysis, fine. Vitamin A is a teratogen, and it also causes lysosomal membrane damage. Pantothenate is non-toxic vitamin, right guys? So these are the toxic vitamins. Vitamin E can be toxic in a way that it causes the decreased activity of vitamin K or the platelet aggregation. Moving to the next question. A 5-month-old previously healthy boy presented with the acute onset of prolonged recurrent seizures activity, followed by neurodevelopmental deterioration, concurrent hair shaft hypopigmentation with the fragility. Initial test revealed significant low serum copper and ceruloplasmin. Okay, guys, one of the important finding. And tortuosity of intracranial vessels means there is a defect in collagen. In addition, a genetic defect, ATP7A gene. So guys, this question is very simple, though the language is maybe difficult in the sense of like it's long paragraph, but The hints, there are 3 hints I have. So most important hint out of all is ATP7A gene and low copper. So guys, what is the disease caused by the low copper? Answer is Menkes disease. Okay, and Menkes disease presents with the low copper, so there is a hypopigmentation because tyrosinase enzymes will be defective. So that's why we started with this term also, that is called as a hypopigmentation. So there will be hypopigmentation, there will be tortuosity of blood vessels. Guys, why? Because the cross-linking of collagen by lysyl oxidase, right? Lysyl oxidase is very important enzyme which is copper dependent, and this enzyme helps in collagen cross-linking, like in the blood vessels, for example. So that is why that is the answer. Wilson's is caused by defective ATP7B, right? That is increase in the copper. Trichothione dystrophy is a disease which is caused by nucleotide excision repair defect, just like xeroderma pigmentosum, right? Gaucher's is a disease which is sphingolipidosis, right? So guys, everything is important. So minerals and vitamins, the 2 things that we have covered right now, and lipoproteins. So I am just telling you the name of the topic which is very important, okay, for the exam purpose. 9-year-old presenting with the symptoms of bilateral lens dislocation, skeletal complication and dystonia at the age of 4 years. Lab evaluation shows high homocysteine. Treatment with a high dose of which vitamin can partially relieve these symptoms? So guys, answer for this is pyridoxine. Okay. So cystathionin beta synthase, that's the name of the enzyme, cystathionin beta synthase. That is an enzyme which is most commonly involved in this process, that is homocystinemia. Got it? So cystathionin beta synthase, guys, that is the best answer here. And this is vitamin B6 dependent. So most common cause of homocystinemia. So pyridoxine. Then guys, folic acid and B12 deficiency can also causes high homocysteine levels, right? But that is not the most common cause, right? That is why we will go with pyridoxine. Okay, pyridoxine, because folic acid and folic acid and B12, they are used in which process? They are utilized in a process called homocysteine to methionine conversion. So this needs B12 and tetrahydrofolate both, fine, by the methionine synthase. So if both are deficient, this will not happen. So homocysteine will increase, fine. But in this case, the answer will be best. We have to go for the best answer, that is. One more thing, guys, that we have to remember about homocysteine is that which amino acid causes risk of heart diseases. So that is our answer. Okay, that is our answer. A patient presented with insomnia. Melatonin is a hormone that brain produces in response to darkness. Okay, it helps in the timing of circadian rhythm and with the sleep. So this hormone is a product of the following amino acid. So there's melatonin. So guys, again a question. What is the question? Question is products of amino acid. Remember, very important. Like arginine makes nitric oxide, histidine makes histamine, glutamic acid makes GABA or the GABA, right? And then tryptophan makes melatonin and serotonin, right? Tyrosine makes melanin and the catecholamines and the thyroid hormones, right? So these are the important products I told you, each and every point. Then guys, next is osteogenesis imperfecta is a disorder of connective tissues caused by abnormality in the synthesis of type 1 collagen. So that is also called as a brittle bone disease. It is characterized by high risk of fractures. Main amino acid that makes the collagen are proline, hydroxyproline and N. So guys, it is very simple. We always talk about glycine XY. Whenever we talk about the repeats of the amino acids found in collagen, it is glycine X and Y. So where the X and Y are given, proline and hydroxyproline, so what is remaining? Glycine. So that is our answer. Glycine is very common, that is 30% of the collagen. Okay, so guys, this is in general about the proteins and amino acids. Which of the following is not a mitochondrial poison? See guys, instead of writing this question in the form of that which of the following is a inhibitor of ETC chain or electron transport chain, I have mentioned mitochondrial poison. So that is one and the same thing. Okay, even if something inhibits PDH like arsenic, that is also the mitochondrial poison. So which of the following is not? So guys, fluoride is the answer, because fluoride inhibits the enzyme which is present in the cytoplasmic enolase, right? Cytoplasmic enolase. Okay, so that is your answer. So guys, let's move to the next question. A political leader was on hunger strike till death. His urine sample gave the following test findings. So guys, as you can see in this test, this is a purple ring of Rothera's test positive, which is given by acetoacetate, but not by beta hydroxybutyrate, not by the beta hydroxybutyrate. Okay, so answer is ketones in the urine, because person is fasting, starving. So these patients are regularly kept being checked, because high ketones can cause acidosis, right? So they are not allowed to do fasting for a long time, though it is a hunger strike till death, but it is actually dangerous, because it can cause excess ketone body production. So guys, little bit of test about the test that is in your notes. You should know about the test. For example, if I talk about Benedict test, that is for the glucose in the urine, then or the reducing substances in the urine. Then heat coagulation test for the protein in the urine. Then you must have covered AMBAND in your patho section. Then there is this test, that is ketones. Okay, ketone bodies, Rothera's test. Fine. So a little bit of test you should always remember. A baby presented with the rare genetic disorders that cause progressive weakness to the heart and skeletal muscles. On the investigation, glycogen was present in lysosomes. So guys, they gave a clear-cut hint of a glycogen storage disease, which is having glycogen in the lysosomes, and only one answer possible, Pompe's disease. Right guys, Pompe's disease caused by the deficient enzyme that is called as acid maltase or the alpha-1,4 glucosidase. Guys, heart has 4 chambers, 2 atria, 2 ventricles. So the name of enzyme alpha-1,4 glucosidase, and because it is heart is affected, so pump is affected. So Pompe's affects the pump. So Pompe's disease is the best answer here, because this is the correct hint. So guys, I told you already that how to approach a question of GSD. If muscles are not involved, or if the question starts with that a patient presents with, because they are talking about skeletal muscles here, so it cannot be von Gerke's at all, and it cannot be Hertz disease at all, because von Gerke's and Hertz affects only liver. Then guys, if lysosome has glycogen, only answer is Pompe's. Now, if the glycogen has a structure which is not normal, answer can be Cory's and Anderson's, like limit dextrin in the Cory's, amylopectin in the Anderson. McArdle's and Tarui's presents with the severe muscle weakness. Next question. A male patient, 47 years old, sought the medical assistance complaining about the progressive appearance of the grayish spot in the sclera and the gray-blue papules on the palms and hyperpigmentation on around the urethra. He also complains of black semen and urine turning black. So guys, we already have the figure, and urine turning black is a clear-cut indication of the enzyme homogentisic acid oxidase deficiency. That is a disease called as alkaptonuria, which presents with all the features given here. And guys, it is also called as ochronosis. Okay, ochronosis is the other name. Name of enzyme is homogentisic acid oxidase. Fine. And guys, in the management, we can give vitamin C. Clinical features are mostly related to the bones. Like the patient can present, apart from these skin features or the darkening of the sclera or the palms or periurethral area, there can be severe back pain. Guys, why? Because this disease also causes the accumulation of this homogentisic acid in the joints. Fine. So can affect bigger joints like spine or the knee or the hip. Fine. So next question. Let's see this enzyme, pyridoxal kinase. Pyridoxal kinase is an enzyme which is inhibited by the drug known as INH or the isoniazide. So B6 deficiency caused by INH is based on this enzyme inactivity. Okay. 18-year-old female presents with the chief complaints of abdominal pain in the upper quadrant right side, that is hepatomegaly, severe. There was associated thrombocytopenia, anemia. So bone marrow biopsy revealed a histiocyte with the crumpled tissue paper cytoplasm. See guys, in the exams you will get a lot of questions which may be bigger than usual, so don't get disheartened कि भाई ये क्या पूछ लिया इतना बड़ा question मैं कैसे करूँगा. Just always look for a point. Always there is a hint in the MCQ which is your one-liner, right? So histiocytes with the crumpled tissue paper appearance, that is a sphingolipidosis Gaucher's disease. Name of enzyme is glucocerebrosidase. So what's the name of enzyme? Glucocerebrosidase. Guys, in the Niemann-Pick's disease, you will find soap bubble histiocytes. Soap bubble or the foam cells. In the Fabry's disease, urine has Maltese cross appearance. Okay, Maltese cross or the mulberry cell, right? Maltese cross or the mulberry cells in the urine. Fine. Gaucher's has crumpled tissue paper appearance. Tay-Sachs disease has onion skinning of lysosomes. When you do the same, biopsy, onion skinning of lysosomes can be seen there. Right, guys? And cherry red spot. Don't forget cherry red spots, which are very, very important. Okay. A young male was diagnosed with familial hypercholesterolemia based on the LDL cholesterol of 300 mg per dl. Achilles tendon xanthoma is also present. See guys, the disease is already given and they are just asking the defect in that. So very simple question. LDL receptor deficiency. This is type 1 where the TG will be high. E2 expression occurs in type 3 where the remnants will increase. Okay, and ABC-A1 defects causes Tanger's disease with the HDL is low. So Tanger's orange tonsils, HDL is low. Type 3, there is palm xanthoma. Okay, palm xanthomas we have to remember, and remnants of VLDL and chylomicrons accumulate. Type 1, TG is high and milky plasma is also present. So if you remember these few points, that's more than enough. Most cardioprotective fatty acid among the following is, see guys, essential fatty acids and essential amino acid. Always remember, very basic questions here. Now most cardioprotective is considered as alpha-linolenic acid. Nowadays, actually, oleic acid is also considered very important, MUFA, monounsaturated fatty acid. But, going with the PYQ and the research till now, guys, fatty acid which are omega-3 are considered most cardioprotective, right? So, go with the option A, right? Option A. And guys, if the option A is not given, then you can go with MUFA, olive oil or the oleic acid. Correct. So 47-year-old male presented with a 4-year history of progressive neuropathy. Symptoms initially started in the bilateral lower extremities. Nutritional history include recent trial of gluten-free diet. He was not a vegetarian. Which of the following vitamin toxicity can be? See, there is toxicity and they are talking neuropathy. So only B6 is the answer. Now they have mentioned not a vegetarian, that is regarding B12, but B12 has no toxicity. Right? Okay, so B12, they mentioned this line so that there is no deficiency of B12 actually, but we are talking about in the MCQ toxicity again. So answer is B6. Rate limiting step of cholesterol synthesis, guys, see the names are similar, but answer is HMG CoA reductase. Guys, rate limiting steps and regulation, I believe you should make a table of that. Okay, rate limiting step and regulation. There is one more question, that HMG coenzyme A is the common, okay, this is the common intermediate, okay, common intermediate of, so guys we can say ketogenesis, leucine catabolism, right? So ketogenesis, leucine catabolism and the cholesterol synthesis, all of them, right? So that is our answer, that is option number C here. Fine guys, the beneficial effects of toxic substances at low dose. Guys, this term probably may be new for you, but if you have attended my class, you must be knowing this, that is hormesis, right? This is a PYQ from, NEET PG exam, okay? So, that is your hormesis or the hormetic effect. We can also call this hormetic effect. Guys, what is hormesis is that, when we expose our body to little bit of stress every day, like for example, if you run every day, so that is actually the beneficial thing to your muscles. Now, you're not breaking your muscles, but training them. You are actually getting what I can say, strength out of that, right? So the low beneficial effect of toxic substance also, right? Toxic substance they have written, but it is something which is all the stress, not just only toxic substance. It can be anything which is a stress factor, right? But low stress, not the high stress. So that is why we are talking about a low. Fine guys, so that is called as hormetic effect. So anything which is not good in high dose or high intensity, but good at low intensity, that is called as a, right? Like, some vitamins are toxic at high doses, but beneficial at low doses, for example, right? Okay. MicroRNA. Guys, MicroRNA, you might be knowing already the tRNAs, rRNAs, and messenger RNAs. So we already know messenger RNAs, T transfer RNAs, and the ribosomal RNAs. So this is a new type of RNA which is written like this, micro RNA. Guys, micro RNA helps in gene regulation. Okay, so this is involved in gene regulation by a process called as gene knockdown. So it is involved in the gene knockdown, right? Gene knockdown. Clear? So that is your microRNAs involved in. Clear, guys? Gene editing, guys. Gene editing is synthesis of B48, from the B100 messenger RNA. Gene knock-in, guys. For the gene knock-in and knockout process, we use a technology which was a recent Nobel Prize also, that is called as CRISPR-Cas9. There is nothing like a knock-up. So these are the three words that you should know, right? They all are PYQs of NEET PG, but can be asked again in the exams, right? Fine, guys. So that finishes our topic. Fine. So guys, what I believe is that we should be able to, again, remember the few things which are commonly asked in exams. One is like how much ATPs are produced, or second is the rate limiting step and how it is being regulated. Third, we should know about all the poisons and inhibitors. Fourth, we should know about all the vitamins, okay, and minerals as a coenzymes and also their clinical effects. We should know all the disorders of amino acids, lipids, and carbohydrates. Fine. Disorders also. So guys, these are the few topics which are the most common topics asked in exams, right? If you see the paper, you will see the paper that most of the questions are only from these topics, and these are not very big topics. We can summarize them in few pages, right? And we can actually get the desired marks, right, guys? So thank you so much, guys. All the best for your exams.